Classification of cephalosporin drugs. Cephalosporins are a versatile class of antibiotics used to fight bacterial infections. But did you know they are classified into generations based on their spectrum of activity? Let's break it down. First generation. It's effective against gram-positive bacteria. Spectrum of activity. Primarily gram-positive cocci, limited gram-negative coverage. Examples: cefazolin, cephalexin, cefadroxil. Uses: skin and soft tissue infections, surgical prophylaxis, mild urinary tract infections, UTIs. Notes: strong against Staphylococcus aureus, not MRSA. Second generation. It's broader gram-negative coverage. Spectrum of activity. Improved activity against gram-negative organisms while retaining some gram-positive efficacy. Examples: cefuroxime, cefaclor, cefoxidin, cefotet. Uses: respiratory tract infections, otitis media, sinusitis, surgical prophylaxis, e.g. colorectal surgery for cefoxidin. Notes: cefamycins, e.g. cefoxidin, are effective against anaerobes. Third generation. It's potent gram-negative activity. Spectrum of activity. Extended gram-negative coverage, limited gram-positive activity. Examples: ceftriaxone, cefataxime, ceftazidime, cefixime. Uses: severe infections like meningitis, pneumonia, UTIs, gonorrhea, and intra-abdominal infections. Notes: ceftazidime has activity against Pseudomonas aeruginosa. Fourth generation. It's broad-spectrum and anti-pseudomonal. Spectrum of activity. Strong gram-positive and gram-negative activity, including Pseudomonas aeruginosa. Examples: cefepime. Uses: hospital-acquired infections, febrile neutropenia, severe UTIs, and sepsis. Notes: penetrates the blood-brain barrier, effective in treating meningitis. Fifth generation. It's effective against MRSA. Spectrum of activity. Broad spectrum, including multi-drug-resistant gram-positive bacteria like MRSA. Examples: ceftaroline, ceftobiprole. Uses: skin and soft tissue infections, community-acquired pneumonia, MRSA infections. Notes: limited gram-negative coverage compared to third and fourth generation drugs. Advanced combination drugs, combining cephalosporins with beta-lactamase inhibitors. Spectrum of activity. Enhanced activity against multi-drug-resistant organisms. Examples: ceftazidime plus avibactam, ceftolizane plus tazobactam. Uses: complicated UTIs, intra-abdominal infections, and infections caused by carbapenem-resistant organisms. Notes: active against extended-spectrum beta-lactamase ESBL producing bacteria. Cephalosporins not classified by generations. Specialized cephalosporins for specific infections. Examples: cefiderocol, a siderophore cephalosporin used for multi-drug-resistant gram-negative infections. Uses: complicated UTIs and hospital-acquired infections caused by resistant pathogens. Notes: newer agent with a novel mechanism of action. Conclusion: cephalosporins are a cornerstone of antibiotic therapy, with each generation offering unique advantages. Always consult a healthcare provider to determine the best treatment for bacterial infections.